And then strategy 4, dealing with bad chronic overuse injuries. So this is when things are getting on the cusp of going. You're getting really pushing the boundaries here before you get an acute injury incident. So overuse eventually causes traumatic failure, like we discussed. This can be muscle, tendon, or bone tissue trauma. This is something you don't want to happen because you're pushing yourself on a timeline where you're going to be maybe 6 months before you're lifting anywhere near what you were lifting pre-injury. No one really knows when it's about to happen, but you need to be wary of the warning signs. So if you take notes in your diary, so if you have chronic pain in your shoulder, you can do a 1 to 10 pain scale. So 1's like nothing, 3's like a slight niggle, 5's like meh, 7's like very painful, have to stop the session, 9's like excruciating pain, 10 is you're fucked and something's went. As an idea, this is not necessarily a scientific way of doing it, it's just a way that if you're consistent with it and you kind of know your scale yourself, much like an RPE, it can be valid within person, so you can use it to gauge your training. So like anything from 0 to 4 is probably okay. Anything from like 4 to 7 is like you should probably watch yourself. Anything from 7 to 9 means you need to deal with it right now, or else it's going to be a major issue. As an example. And then once you get into the point where you're hitting like a 6 to 8 pain scale, to nip it in the bud, modify your training so it's 100% pain free. So if you find during a squat movement, when you hit the bottom, you get an acute pain in your knee that's somewhere in the scale of a 6 to an 8, squat to a box or limit your range in that movement, or change to single leg exercises for a while and be 100% pain free. Normally I would say you need to do that for about 3 weeks at a minimum, maybe out as far as 6 weeks if it's constantly a problem. So let's say you squat the box for 3 weeks. While you're doing that, you're massaging, stretching, performing single leg strengthening work, hamstring strengthening work, glute med strengthening work, and then you come back to squatting a lighter load. Normally start at about 30% for like 3 sets of 15. It's pain free, and then we use 3 sessions a week to systematically build that load up at say 10 kilo jumps or 5 kilo jumps, and then we get back to the load we were using after about 2 weeks, and it's pain free. You're good to go. You can just go back to normal training. And during this process, fight fires to treat symptoms. So include things like foam rolling, stretching, all the strategies we've discussed ad nauseum in this lecture. And if you can, include a professional to get a treatment plan. An excellent idea, although I appreciate an expensive one for some people. And then strategy 5, you fucked up. Deal with it. We are now dealing with an acute injury.
What color panties am I wearing?
Pink. G-string.
Black silk.
I didn't see you get dressed this morning.
Now listen to what I'm saying. You fucked up, right? Yeah, you fucked up big time. You fucked up, right?
I never seen.
You know what I'm saying?
I never seen.
You know what I'm saying? You fucked up, huh?
I never.
No. I see. You fucked up.
I never seen. I didn't.
Dealing with an acute injury due to overuse. First of all, most importantly, everyone says it, but you have to do it. Immediately seek medical help to see if operation or other clinical intervention is required. If you break your leg, go to hospital. I know it sounds obvious, but it needs to be done. So if you suffer a bicep tear, you have to go to hospital, or you have to see your doctor to get it sorted. Don't go see your chiropractor, go see a doctor. After you seek medical attention and they've dealt with it on their part, they've done a scan, this is your issue, here's what we can do from our point of view. If you have the resources, go seek the consultation of a rehabilitation specialist. My ideal would be a sports physiotherapist, and a good one. If you know by word of mouth there's one around, as they will be best suited to deal with your problem. A normal physiotherapist deals with normal people who have broken their arm getting back up to the level of normal day-to-day tasks. So if you're a receptionist and you've broken your hand, their rehab plan will make you able to type again. if you're a strong man and you squat 360 kilos, that remit might be slightly outside of their specialty. So they might not necessarily have the toolbox to best deal with your kind of case scenario. So if you know a good sports physiotherapist, especially one that deals with strong, powerful athletes, someone who deals with rugby, someone who deals with throwing, someone who deals with lifting, go see them. It'll be worth it in the end. Then once you've dealt with them, you have a rehabilitation plan and process, and we're at the stage where we're getting back into barbell training, or we're getting back into sports training. Follow a systematic and targeted plan to reintegrate yourself into your sport and training. Don't just start right at the level where you're pushing yourself to the max. There's a video on this I have called the 4-stage plan of getting out of Snap City. I'll put a link in the description. Have a look at that. It's ideal. Okay, and to conclude, overuse injury is part of any lifting sport due to the repetitive nature of what we do. We, like in a bench press, we move through the same line. The better your technique, the more repetitive what you do is. Therefore, overuse is a part of the sport and needs to be dealt with. Prevention, first and foremost, is the most important thing to nail. If you move wrong, starting to move right is the best thing to do. Flexibility, technique, planning, addressing weaknesses. These are all the things you need to do first and foremost to stop this being an issue. If it's become somewhat of an issue, then maintenance is very important. Things we talked about, like massage therapy, foam rolling, mobilization, stretching, making sure your recovery is sufficient, possibly supplementation in some cases, are strategies you should implement. Being smart with your training is better than getting surgery. So planning your week properly, planning your loading properly, making sure your technique's good, making sure you're doing the kind of supplementary training the smaller muscle groups, training things like your core stability, training like your stability on one leg. All of these, especially in a sport like strongman, are important things to do due to the dynamic nature of your sport. Make sure you're on top of all that stuff. The end point, we're trying to stop overuse injury, which is preventable in almost all cases by being smart about what you're doing. And it's better to prevent something than undergoing 3 months of surgery or a year of rehabilitation. I'm sure anyone who's had a major sports injury will back me up on that one. You don't want that happening. Okay, that concludes this talk. Any thoughts or comments, chuck them in the comment section. Send an email to speedpowerperformance@gmail.com. Get on the website, castironstrength.com. Have a chat in the forums. Subscribe, like, dislike, engage. And that's what's going to make this community grow. I hope you find this of use and it's not been too boring. This is Mark of castironstrength.com signing off.